My name is Dr. Martin. It says here you're due for your exam today, your physical. Is that so? Okay. You had set an appointment up with us about a month ago. It says here. Yeah, just about a month. Um, yeah, it's showing up on the chart here that you need to have your physical done. Those are always preliminary kind of tests that we need to run just to make sure that there's nothing going on or there's no shots. We're just here just to make sure everything's going all right. If you could please, let me make sure I got the right chart here. Yeah, could you please state your name and date of birth, please? Okay, and you said that was okay. So you said your DOB was your date of birth, okay. And your name and your last name, please. All right. So I think we got that in the record. I'll update that into our system towards the end of this exam. Let me just go through here and make sure we don't need anything else from you. We've already got your vitals. Yeah, I guess the nurse came in and got your vitals. Is that so? Alright. It says here your vitals were 85/170. Okay. So are you taking any kind of medication? Whether it's recreational or prescription? Okay. Do you have a list? Do you have that list with you? That'd be great if I could. Okay, let me just... Thank you for that. Let me just check over these medications real quick just to see if there's anything going on. We'll just... Okay. So it says here you've taken your Vraylar, your doxycycline. Is that for your acne? Okay. You've got omeprazole. You've got trazodone, it says, for sleep. Is that it? Okay. Those are some very good medications. I do recommend those, and keep up with those and make sure you are on the right dosage. If there's any changes, please let me know, and I'll make sure we'll get them in the pharmacy. Oh, by the way, what pharmacy are you with? Are you with the one off of the 85? Okay, yeah, well, it's pretty local here. I'm glad you were able to be accustomed to going there and getting your prescriptions. That's very helpful. 85. Alright, so it's just been one of those mornings, where you got a lot going on and no time to adjust. Let me just grab a drink real quick and we'll get right on that exam. Just some energy. Alright, so let me see what we got going on first. You were at the park earlier and with some dogs and some other people, I see. Or is that what you're telling me? Okay. Let me go ahead and check that little injury you got on your bump on the forehead there. And you scraped your knee or something like that. Okay. Yeah, we can definitely check those out. Make sure they're not infected, or make sure they're gonna heal properly. But let me go ahead and check your eyes real quick with this little tool here. If you could please just stare directly behind my shoulder here, and we'll check your right eye. Let me grab a card to cover up your right eye real quick, and we'll just get a card here. Alright, if you could please, I'm just gonna make sure you're not wearing any glasses. Just cover up your right eye, and that would be great. We'll just go ahead and do that here. Okay. Let me just shine this light just to make sure there's nothing Nothing that we need to be aware of here. So it's showing here up on the system that we need to up the dosage on your trazodone. Okay, yeah, we can do that. Just, alright, cover your left eye for me and stare directly over my left shoulder here. My left, your right. We'll check the left eye now. Alright, looking pretty good there. Let me shine it from the top. Just look down for me, please. Alright, and then if you could look left. And look right. Okay, that looks pretty good, I would say. Let me see if let me check your mouth there to make sure we're all good there. Alright, if you could just please open wide for me, we'll use this tool, make sure it's sanitary for your mouth here. Let me get some wipes. Got some swab here. We'll just go ahead and give this a good wipe and make sure it's nice and sanitary. Alright, let me just wipe this down for you and we'll check your mouth here in a minute. And just get that wiped down. Sure we're good. And clean, nice and clean for you here. Alright, just about done. Let me just make sure we get it all in sanitary. Because times are tough right now with, COVID being around and people getting sick and whatnot. So you always got to be careful around that kind of situation. We'll just put that aside. Let me let this dry up a little bit. While we're waiting for that, let me go ahead and check inside your ears. Get it up real quick and check inside your ears. So it's showing here that I'm not really seeing it. No, I don't see any earwax or cerumen, is what it's called in the medical field. Yeah, I don't see any earwax on this side. I'll go ahead and check the other side real quick. Is there any kind of earwax on this side? Are you having any problems with hearing lately? No problems. That's very good. We'll just all right. So that's looking pretty good, I would say. Inside your ears checks out. Let me go ahead and write some notes down. Alright, where's my pad of paper here? What do we got in here? Let me just get the right note out. Make sure we get that for later there. Alright, so ears do check out okay. So we'll just, write little notes here and there just to make sure we're up to date and we don't lose anything in the files. Let me just catch up on my notes real quick and we'll continue. How's your day been so far? Yeah, that's good. It's good to hear. Very good to hear that. Alright, I think we're good. Alright, let me go ahead and check inside your mouth now with this tool that I got here. Alright, go ahead and open up wide. Say ah. Alright, not really finding anything suspicious. It does look a little raw. Have you been coughing lately? Yeah, you have. Yeah, that can make your throat a little upset or feel raspy or whatever. Yeah. Alright, that looks good. We'll get something for that. I think I've got just the thing. So we've come up with this new remedy for sore throat and strep throat. Actually, they work together. Let me just get this ready here, and it'll just take a day instead of it taking a couple of days. It'll only take a day for this new remedy that we've got. So what I'm going to be doing is taking this syringe and some of this product here, and we'll make sure that gets inside your throat. You just gotta coats the inside of your throat. It's kind of like one of those Vicks vapor rub kind of techniques, but it's not. It just goes on the inside here, and it coats it, and then it makes it all feel good. So let me just get some of this real quick. Okay. Let me make sure we're doing all right over here. Let me just get some of that. Okay. So we put that aside. Sometimes these lids can be a little troublesome. Oh, and you were saying you said you had your sinuses are all kind of stuffy. Alright, I think we can help you out there. But first, let's go ahead and open up your mouth here real quick. We're just gonna go ahead and put some of this in there, and it'll coat the inside of your esophagus, excuse me. And it'll just, make it feel better within a day or two instead of a week. You know how it usually is. Alright, go ahead and open up wide for me. We'll just put some of that in your throat. Alright, and get one more going here. Just make sure we're nice and coated. And then all you'll need to do is just kind of gargle your throat around. Make sure it's covered evenly. Alright, looks good. We'll throw that into the sharps container. So, and then I've just got some basic nasal spray that we can use here. It'll help out with your nose and your sinuses and all that. So basically, all you gotta do is, put this in your nose and go like that on each side, and then on the other side as well. So let's go ahead and do that. Alright, there's that. How is that? Okay, you want some on the other side. Usually you do 2 squirts on each nostril. So we're gonna do one on the other side now. Okay. One more here. We'll do one more on each side. Alright, last one. Okay. That'll just give that some time, 15 to 20 minutes, and that'll clear up the nasal problems that you got going on. Alright, let me make sure we're writing down on these notes here. Also, forget to put them in the system later. Let me just get my paperwork out. Alright. So we got that out of the way. Okay, yeah, sorry, I have just got my next appointment is coming up. That's what, I don't know if you can hear that, but I keep getting email saying my next appointment is coming up in the next 10-15 minutes. So don't worry, we still got time for your exam. We'll just have to make sure we get it all done in the right order. Alright, and then, so now that we've got that on our file, we'll have to manually put that in, or I will have to put that in later, at a later time. Let me just check out your hearing. Sorry, let me check your lungs here and your pulse. Alright, just breathe in and breathe out. To the other side, breathe in and breathe out. And check your lungs. Breathe in and breathe out. Breathe in and breathe out. Alright. That all sounds pretty up to par there. Let me check your pulse. Just one other thing. Let me go ahead and check your pulse. For this, we don't need to put it in our in our ears. Sorry, because we're not checking the hearing. We're checking the pulse. So we don't need to put it in her ear or anything. Yeah, it makes sense, right? Let me go ahead and check that pulse on your carotid artery. And we'll do your jugular on the other side. Okay. Turn this around. So it's saying alright, that all feels pretty normal. Alright, let me get your band-aid going here, because I understood you fell at the park. Okay. We've got some pain relief ointment here. We'll just go ahead and apply that and make sure we're all professional. And then we'll apply some bandage. And then let me get you a band-aid real quick. I've got this band-aid pouch over here. And then I think we're gonna need some antiseptic. So we're gonna use this first aid antiseptic cleaner just to make sure we get all the debris out. And some allergy pills, that's always good. And then we can get you a band-aid. Alright, so let me first start off by cleaning that wound on your forehead there. Give this a shake. It's no sting, so don't worry, it's not gonna sting or anything. Alright. Let me know when you're ready. Alright, you ready? Okay. Alright, here comes the first one. How's that? Does that sting? No? Okay. I'll get one more good spray and we'll be good to go. Alright, that's good on that part there. So, we're gonna next put on some Neosporin. It's always the best. Get some on my finger here. Alright. Just go ahead and make sure it's all kind of worked in. Alright, now let me go ahead and wrap that up a little bit so that way no debris or anything can get in there. We'll keep it protected. It's just some gauze, sticky gauze is what I like to call it. Tear off a nice little piece. It's this magic like fabric that sticks to everything. Alright, let me just apply that. Alright, that should be good there. Now, the last thing we'll do is I've got some. This is just some all-day allergy pills. It's generic, so it's over the counter kind of. You don't need a prescription or anything for it, which is always nice. So we got a couple pills here. We're gonna make sure we get them all of them out. Alright. I think we've only got 1, 2, 3, 4, 3 and 5. So we got 5 pills. They don't give you a lot. It says 30 tablets, but they don't ever give you that many. So let me just give you one just to be sure. And then I'll let you take one home for later in about 4 hours, give or take. Alright, I'll let you get that pill in there. Alright. Go ahead and, there you go. I'm gonna get you one more just to, that way you can have it for when you get home. Don't take it immediately because you'll pass out and it's not good. So just after 4 hours you can have another one. So here it is. I'll just let you carry this with you in your little pocket. And you should be good to go. Thank you for stopping in, and I will see you on the next video.